This conference will now be recorded.
This is a recorded webinar, a training for COVID-19 vaccine outreach. The intended audience for this recorded webinar are people in Lincoln County, Oregon, who support COVID-19 vaccination and who want to help people at risk access the COVID-19 vaccine. The goal for this training is to increase the number of people in Lincoln County, Oregon, who can accurately and confidently answer basic questions about COVID-19 vaccination and help people at risk for COVID-19 get signed up for the wait list, schedule their appointments, and overcome their barriers to getting to their appointment for vaccination. The groups that are in the greatest need of outreach and that we're looking to our Lincoln County community members to reach out to are people who are 65 or older, people who are 16 to 64 with high-risk chronic conditions, and essential workers who are not able to or may not be able to access the vaccine through an employer. We're also wanting to reach out to people who have difficulty using the internet and computers, people with limited English reading and speaking abilities, and people who have difficulty driving or getting transportation. That would be a barrier to them accessing an appointment. The agenda for this recorded webinar is to cover COVID-19 vaccine facts, how to get a vaccine in Lincoln County with a peek into one of our mass vaccination clinics, these vaccine sequencing and distribution, how to help with outreach, and important resources for outreach, and we'll also include a demonstration of how to navigate our websites, as well as how to sign someone up for the wait list and how to schedule an appointment for vaccination. So to start off with COVID-19 vaccine facts, the COVID-19 vaccines that are currently approved for emergency use in the United States are safe and effective at preventing COVID-19 illness. We know this because the FDA, the Federal Drug Administration, only approves safe and effective vaccines that are tested through large, rigorous clinical trials. All steps of the FDA's rigorous vaccine testing process were completed for the two vaccines at this moment that are currently approved for emergency use. The timeline moved faster on these because of prioritization, funding from the government, and some simultaneous processing and review. No steps were skipped. It just became our greatest priority. The Pfizer and Moderna final trials included more than 70,000 volunteers. Those groups included 21 to 25% over the age of 65 or at 65, 20 to 26% identifying as Latino or Hispanic, 10% identifying as Black, and 45 to 46% identifying as having one of the high-risk chronic conditions that increase risk for severe COVID-19 illness. Such chronic conditions include obesity, diabetes, chronic obstructive pulmonary disease. COVID-19 vaccines are the safest way to build immunity against the virus that causes COVID-19. COVID-19 vaccines are the most reliable way to prevent COVID-19 illness and death. It's one of many strategies that we'll need to use in order to prevent us from having more COVID-19 outbreaks and more preventable deaths. The reason it's the most reliable is that you get one shot, two shots, and then there's immunity that is built versus having to every single moment of the day be mindful of wearing a mask, keeping social distancing, washing hands, preventing face touching. So the one to two behaviors is much more reliable than having to do an incountable number of behaviors throughout the day. COVID-19 vaccines, both are available. Those that are available in the United States require 2 doses of the same vaccine, so either 21 for Pfizer or 28 days apart. It takes a few weeks for the body's immune system to respond to the vaccines, so it takes over those weeks between the 2 doses and then 1 to 2 weeks after to reach that level of effectiveness that was found in the research studies. So Pfizer is 21 days apart and then is 95% effective at preventing COVID illness or preventing severe illness within 1 week after the second dose. Moderna is 28 days apart and is 94% effective at 2 weeks after the second dose. It's important to note that when someone is signing up to get their COVID-19 vaccine for their first dose, they should be planning when they will get their second dose. It's important to sign up for that second dose appointment either when signing up for the first dose or if they're going through our vaccine clinics for Lincoln County Public Health, they would sign up immediately after receiving that first dose. It's part of the observation period to get signed up for the second dose during that 15 to 30 minutes of observation after getting the shot. Most side effects of the COVID-19 vaccine are mild. Common side effects include soreness at the site of injection, feeling tired, having a headache, low fever, chills, and joint pain. These side effects are the result of the immune system working. So it can be seen as a positive in that we know if we're having some of those symptoms, the immune system is responding to the harmless RNA protein that was injected into the body. Severe allergic reaction, anaphylaxis, to the COVID-19 vaccine is extremely rare and is the most concerning of possible severe reactions. It happens usually within 15 to 30 minutes of vaccination, which is why we have a 15 to 30 minute observation period after someone has their vaccine. People who have had allergic reactions to other vaccines should consult their doctor about whether they should get the COVID-19 vaccine. It is still possible to get a COVID-19 infection and to get ill from COVID-19 after getting vaccinated. This is not from the vaccine itself. It would be from an exposure that a person had from the environment or from people that are in their environment. If someone does get infected between their first and second doses, they would need to complete their isolation period, which is usually about 10 days, before they can have their second dose. If someone tests positive with COVID-19 after their first dose, or at any time really, someone from Lincoln County Public Health, one of our communicable disease nurses, or someone who works with our communicable disease program, would be contacting that person to do a case investigation and to identify their contacts, and that would start our contact tracing, which is an effective way to prevent further spread of that infection. When they're contacted for that case investigation and contact tracing interview, they will provide them with the end of their isolation date. So as soon as their isolation is done and it is time for their next appointment, that means they've already completed the 21 for Pfizer or 28 days for Moderna, then they can schedule that second appointment and get the vaccine. It is not possible to get COVID-19 from the Moderna or Pfizer vaccines. These are mRNA vaccines. They simply provide a code for a harmless protein. It's the same protein that is on the outside of the SARS-CoV-2 virus that causes COVID-19, but it's just a piece of the outside. It teaches the body to look for that same protein whenever it is later exposed to the actual virus. An analogy that I use for this is that if the SARS-CoV-2 virus that causes COVID-19 is a confetti cupcake, so that whole thing would be the analogy for the virus, then the mRNA vaccine is just the recipe for the sprinkles on the outside of the cupcake. So it's not the whole package. It doesn't function the same as that whole package would. It's really just a code to create something that is a piece on the outside, and it's not going to have the same kind of function as the whole virus would if you had the actual viral DNA, which would be deep inside that envelope. So COVID-19 vaccines are free because the federal government has already purchased them by the time they reach you at the local area. Some administrators may charge an administrative fee for the administration of the vaccine, and that fee would be billed to insurance. Lincoln County Public Health, for our clinics that we're providing, we do not charge any fees, and no one would need a insurance card to come through one of our clinics, which I'll talk more about shortly. Wearing masks, social distancing, and washing hands are still important for preventing transmission even after getting the vaccine. We can't carry around and share viruses without ourselves getting sick from that virus. One reason for that is that the viruses, especially a respiratory virus, would come into contact with the body through the mucous membranes in the mouth, the nasopharynx, inside the nose, and in our eyes. And so if we laugh, sing, talk, or cough or sneeze, we can share that virus. Or if we rub ourselves across our face and touch a doorknob, anything like that, we can still share that virus even though we ourselves are not having the disease, we aren't having symptoms, but we can be a vehicle to transport that virus around. So we still want to have our masks, maintain our social distancing, and wash our hands often. COVID-19 vaccine safety is very important to the federal government. There are measures in place before a vaccine is authorized. That is the Federal Drug Administration review process, as well as the ACIP, which is the Advisory Committee on Immunization Practices for the federal government. They also review and recommend usage. And then after authorization, the FDA and the CDC continue to monitor vaccine safety. The normal way that this occurs is through the Vaccine Adverse Event Reporting System, VAERS. That is the usual database that we monitor adverse effects through. And then with COVID-19, the CDC implemented a new process that's more accessible. It's an app called vSafe. Everyone who gets the COVID-19 vaccine is given this information on how to access the app. Once you register that you've received your first or second dose, then you get 5 days of text messages, and you respond to it and say what kind of symptoms you had, whether they were mild, moderate, or severe, how long they lasted, and how they impacted your day. That vSafe is also optional. You do not have to sign up for it. You just have access to it once you receive your vaccine. How to get a COVID-19 vaccine in Lincoln County. So we are entering into the second section of this training webinar. So there's a number of ways to receive the COVID-19 vaccine currently, and then coming soon, there will be some more opportunities, and in the future, it will be slightly different too. Currently, we have public health vaccine clinics that are being offered in 2 locations in Lincoln County. These are free and no insurance is needed to attend these. We are scheduling these public health vaccine clinics through Lincoln County Public Health, and we're using our wait list, which I will describe more, to invite people to schedule their appointments when they become eligible and based on the prioritization sequence that we need to follow, which I'll describe a little bit more of that shortly. The Confederated Tribes of Siletz Indians are also receiving vaccines, and they are also administering vaccines through their community health clinic. But those are limited to current members of their clinic and current members of the tribe. So if you are already, or if somebody is already a member of the Siletz Community Health Clinic, we encourage you to reach out to them and ask them about their process for vaccination. Their vaccines would be scheduled separately. They're not using, at least currently, the Lincoln County Public Health waitlist. Starting soon, private retail pharmacies, including Safeway, Fred Meyer's, and eventually Rite Aid, will be implementing COVID-19 vaccinations. They're receiving their doses separately, directly from the federal government. Currently, they are not using Lincoln County Public Health's waitlist, and they would need to be signed up for separately. And they may charge insurance for an administrative fee. We are not sure, because they're a separate entity, how they will be implementing their vaccine distribution. They will still need to follow the prioritization guidelines. In the future, primary care clinics will likely get the vaccine, but we do not know when that will be. But that is just something to keep an eye open to. Our opportunities of where you can get the vaccine will be ever changing as more vaccine becomes available and their systems and structures get developed. So the rest of this information is really focused on getting vaccines through Lincoln County Public Health. Most vaccines right now are being distributed this way. Lincoln County Public Health is getting the bulk of the vaccines from the state and federal governments. So how to get a COVID-19 vaccine? The first step is to wait patiently. Everyone who wants a vaccine will eventually get the vaccine. The goal is to be into vaccinating the general public by summer. Some goals have been set for April, but current guidelines are looking like it will be somewhere around late May or June. So please, we ask our communities to wait patiently, but to still be prepared to accept the vaccine if it becomes available, and really to help those who are currently eligible get signed up on the wait list and get scheduled. The sooner we can make sure we've covered those who are currently eligible, the sooner we get to the next eligibility groups. So you can check eligibility and to see what opportunities are available through this website here, Lincoln County Public Health Vaccine Schedule webpage. This is the link, but later on in this training video, I will navigate us to that website and show how to get there and how to check the information that's on the website. Another option is the Oregon Health Authority eligibility checker. This will just check current eligibility status, and so you can screen yourself through that checker to see if you are currently eligible under the groups that are currently eligible. 3, everyone and anyone in Lincoln County or anyone who lives in Lincoln County or receives services through Lincoln County or works in Lincoln County will be able to sign up for the Lincoln County Public Health wait list. It's basically a list that says, yes, I want the vaccine when it is my time. Please reach out to me with the scheduling link whenever I become eligible. This is what we're asking our community members to help others sign up on. Because this is an electronic list, or you would have to call in to our call center, we want to make sure we have more options for helping people get signed on, and that's why we're really doing this training to reach out to more of our community partners who can help with getting people signed on to the wait list. Preferably that list of people who have the greater barriers to accessing the vaccine and are currently eligible. The next step is to just prepare to prioritize that vaccination over other things. It could be having to call out of work or having to adjust work schedules to be able to get to a vaccine appointment. We have very limited resources, and it's very difficult to plan for vaccinations in anything but big groups of people, because we have to make sure that we are administering all of those doses within a short time frame while the vaccine is viable. So it's very important to be ready to jump into one of those mass vaccine clinics if you're given the opportunity. You may have 1 to 2 days notice or a couple hours notice, depending on the circumstance. So a little bit more about our mass vaccination clinics. These are by appointment only. Appointments are available based on Oregon's vaccine sequence, which I'll cover in a moment. We are currently offering them as of right now, February 17th. We are offering them in 2 locations through Lincoln County Commons in Newport, which is our fairgrounds, and then also the St. Clair or Taft Fire Station in Lincoln City, being operated by our North Lincoln Fire District partners. There is a potential for future mass vaccination sites in the future, but right now we are limited to these 2 locations because we are extremely limited in resources, which includes having all of the humans we would need to be able to operate one of these clinics. Just for example, the Lincoln County Commons clinics that we have, where we're capable of vaccinating up to 620 people a day, those require about 50 people to operate those clinics every day. And we're pulling from various partners and volunteers to be able to operate these clinics, but it is quite a workload to be able to organize multiple clinics at once when we already have a strained capacity. Soon we will have other vaccine providers. We know our private retail pharmacies are working on getting able to deliver vaccines. They're currently accepting signups, or they have web pages that are preparing to accept signups. And I will show you where our web page will have links to those. There may be other vaccine opportunities available that will get posted on our Lincoln County Public Health web page, which I'll show you in a moment. It's important to note that signups for these would be separate, and they would go directly to the retail pharmacies themselves, and if you were on our wait list, you would not be getting signed up for these retail pharmacies because they will not have access to our wait list, at least as it is currently. These retail pharmacies may also bill insurance, and that's just something to be mindful of and ask when that appointment's being scheduled, whether or not insurance card is needed for the appointment. So a little more of a peek into our mass vaccination clinic. This is a map of where our mass vaccination clinic is at the Lincoln County Commons, which is our fairgrounds in Newport. This shows you an overhead view of the building. There's parking right in front of the building. This is the front door on this left-hand side. Oops, there we go. This is the door here, front entrance. And then there's also parking in the back over here. There's also some street parking along 3rd Street. This is north of Highway 20 and east of Highway 101, just to give a reference point. This is the image of what it would look like turning into the Lincoln County Commons from 3rd Street. There's signs up that give arrows of where to go. These are what the signs look like. And just a reminder, appointments are required. There is no chance of getting an appointment if you walk in or show up. The only thing that happens is that it creates more delay in those who have appointments being able to get in and out of the clinic. So this is the very front of what you would see when you walk into the front door of the clinic. This first station and table here is the check-in station. Individuals who are coming to this would have an appointment, and so they would need to be on the list that we have. So the check-in would be scanning through and making sure that the name is on the list, that their identification matches that name. There is a form that needs to be filled out that would be emailed to the person who signs up. It's linked into our scheduling platform so that it can be downloaded and printed and then brought in. But we also have copies of it at this event. And over here on the far right-hand side, you can see tables and chairs that are set up so that if the form isn't already filled out, there's a long table here that goes, forward where we can't see, where you can sit and fill out the form as needed. Then you can see behind here, there's section 2, where there's a bunch of chairs that are set, and individuals would come in, get checked in, make sure their form's filled out, and then sit in this waiting area while we wait for the group to collect. Once the group starts collecting and the other group that was in the vaccination area has vacated, individuals will be brought into this vaccination area, which is on the left-hand side of the photo, just out of view. But all of usually about 36 to 42 people would be filed into this area. And then as a group, the individuals get the informed consent information about the vaccine, learn all about possible side effects, and then what happens next. They do that all together as one group, and then the vaccinators go through and they vaccinate everyone table by table. And then they would walk through this back door here in the back to get to the observation period and where they would sign up for their second appointment. So this is just a close-up of that waiting area, section 2. This is the view of the vaccination area. So this is section 3. So after waiting in the waiting area for your group to arrive, you would then come in and take one of these chairs to wait for your vaccinator to walk through and do the vaccine. And then as soon as you're finished with your vaccine, you go to the observation area and just hang out there with your book or your phone or your newspaper, whatever you enjoy. Sometimes it's with people that you know, but you'll see everywhere throughout the clinic, we have 6 feet of space to maintain social distancing and everyone is wearing masks. If there is an instance where someone needs a recovery area with privacy, we have privacy screens set up and these recovery areas. We have EMS, emergency medical system personnel staffed in this area, and they monitor individuals for any adverse reactions. To date, we have not had any adverse reactions. We've vaccinated about 6,000 people and have not had any reactions at these mass vaccination clinics. Nationally, with 4 million, I think it was more than 4 million doses administered, there were about 10 anaphylactic reactions. So that's a rate of about 2.5 per million doses administered. So it's extremely rare, but we're prepared in case. And then in this area, while the person is waiting for their 15 to 30 minutes of observation time, they would schedule an appointment with one of our schedulers here. All the appointments are made. We're mostly doing Moderna vaccines through our clinic, so all the appointments are made for exactly 28 days, which is 4 weeks from the time of the first dose, and we're scheduling for the same time in that date, whatever 4 weeks from the date of the first appointment is. So that's the end of this section, and now we're moving into vaccine sequencing and distribution. This is Oregon's vaccine sequencing plan. This is what we are following and what we're required to follow for vaccinations. Vaccines started on this far left-hand side under phase 1A. There are 4 groups included in phase 1A. Most of these individuals are healthcare workers, either inpatient, outpatient, starting with those who are most critical for the emergency response system for COVID-19 response, moving out to other types of healthcare that are needed to maintain our public health and healthcare systems. Individuals with intellectual and developmental disabilities are also included in this because they have a very high risk for COVID-19 severe outcomes. And then also caretakers and home caretakers are also included in this list here. Next, in phase 1B, this group started after phase 1A, all had access to the vaccine. Phase 1B includes group 1, child care providers, early learning, and K through 12 educators and staff. Group 2, 80 and older. Group 3, 75 and older. Group 4, 70 and older. Group 5, 65 and older. We are currently moving into group 3 because today is February 17th. So technically, group 3, 75 and older, and all of these other groups are eligible to sign up for their COVID-19 vaccine. However, being able to schedule an appointment is dependent on whether or not we have vaccine. This video right now is being recorded during the winter storms that have happened across the United States, and dosages, delivery of dosages has been delayed. And so right now, Lincoln County Public Health is not signing up people 75 and older for appointments because we don't have appointments to give. But as soon as we do have appointments, we phase in signing up for those appointments by anyone who's still remaining on our wait list in phase 1A, anyone who's in group 1 of 1B, then group 2, and then group 3. So we have a phase-in approach so that those who are remaining in these previous groups have an opportunity to sign up before the later groups. Then we know that group 4 will come next, which is 70 and older on February 22nd, and then group 5, 65 and older on March 1st. Then after that, we still are waiting for this vaccine schedule to define who the remaining groups are. We know they will be essential workers, or as the CDC or as Oregon Health Authority defines here, critical workers in high-risk settings, workers in industries essential to the functioning of society and a substantial risk of COVID-19 exposure. This is likely going to be essential workers who work in food systems, transit, those type of things that really maintain our basic needs, which is access to food, water, shelter, and healthcare. And then there's also the group of people of all ages, underlying conditions that put them at moderate risk. We do not know the specific criteria for these yet, and we're waiting on the state to define them. But in the meantime, we are using the CDC's, the Centers for Disease Control and Prevention's guidance to help predict what groups will likely be next. These are the factors that go into identifying which groups will be included in the vaccine sequence and which ones are prioritized over others. So amount of exposure to the SARS-CoV-2 virus that causes COVID-19 is one of the first factors, plus the risk of severe illness, plus role in the critical infrastructure of society, and that's that essential workers maintaining food, water, shelter, and healthcare. So those 3 factors are considered together, and that together creates the vaccine sequence. And so if we go back to this list, we can see the reason healthcare workers were prioritized first, and other groups such as people with intellectual and developmental disabilities were included in phase 1A. For healthcare workers, it's because they have both a high risk of exposure and a role in maintaining the critical infrastructure needed to survive the COVID-19 pandemic. For people with intellectual and developmental disabilities and people living in long-term care facility and hospice, there's the risk of severe illness, and because they're sometimes in a congregate living like group homes or long-term care facilities, there's also the high risk of exposure in those congregate living facilities. And so these three factors are really important to think of when you're asking, am I going to be included in one of these groups, or will I be waiting for the general public, which will come eligible around late spring to early summer? This is just another way of looking at eligibility in Lincoln County specifically. We started with phase 1A along with the rest of the state and included all 4 groups and worked on getting our phase 1A individuals vaccinated. We largely worked through employers or service agencies. So we reached out to employers or healthcare workers or emergency services or first responders to vaccinate their staff. And then we also worked through service providers such as our county developmental disabilities services that were able to reach out to the community members that they serve. Then around January 11th, we added in childcare, early learning, and K through 12 being eligible. That was slightly before the state opened theirs, and that's because we have a smaller amount of healthcare workers being in an isolated rural area that is medically underserved. We have a lower amount of phase 1A workers, and we will end up having a much higher amount of individuals in the older adult population and in the chronic conditions population. So though we're moving a little bit faster than the state now, we expect to have a little bit more time needed for our phase 1B and 1C groups. This is the current status as of yesterday, February 16th, of distribution of the vaccine in Lincoln County. So as of yesterday, we had administered 8,765 doses, which is about 12% of our total population in Lincoln County. And it's a higher number for out of everyone who would just be eligible, thinking of eventually being eligible, which would be 16 years and older, because the vaccines are currently not approved for use in youth. So which groups will be next? We know that 75, 70, and 65 all will be next in the queue or in line for the vaccine. What's not included yet, at least explicitly in Oregon's sequence, is 16 to 64 with high-risk chronic conditions and frontline essential workers. So we know that they will be next because they've been recommended by Oregon's Vaccine Advisory Committee, but we don't know the criteria yet for what individuals would need to have to qualify in these 2 groups. So this information that I'm providing next is based on the Centers for Disease Control and Prevention, their definitions. So we expect that these following conditions may be prioritized for inclusion for Oregon's vaccine sequence. So that would be individuals 16 to 64 with cancer, chronic kidney disease, chronic obstructive pulmonary disease, COPD, Down syndrome, which was actually already included in our phase 1A because Oregon included individuals with intellectual and developmental disabilities, heart conditions, immunocompromised state, obesity and severe obesity, pregnancy, sickle cell disease, smoking, and type 2 diabetes. And just a caveat again, this is based on the Centers for Disease Control prioritization recommendations, and Oregon's may be different than this list. So we are using CDC's right now, but whatever Oregon publishes will be used in place of the CDC's recommendations. So this might change slightly. For frontline essential workers, this is what the Centers for Disease Control and Prevention included for their list of recommended essential workers. Oregon's may be different, and we are waiting to see what Oregon defines as essential workers, or as they called critical workers. So most of these that the CDC has, or at least half of these that the CDC included, were already included in Oregon's phase 1A, so they've already been vaccinated. And the additional ones are food and agricultural workers, United States Postal Service workers, manufacturing workers, grocery store workers, and public transit workers. Then the CDC also provides an additional group that they recommended for a subsequent phase, which included transportation and logistics, food services, which would mean restaurants, that type of food service, housing, construction and finance, information technology workers, communications, energy, law, media, public safety, and public health. Public health was actually included in phase 1A in Oregon. So we are in a wait and see hold pattern to see what will come up with essential workers, but we do allow people to put themselves into the wait list and identify themselves as essential workers, and then we would be sorting through that list later once the Oregon vaccine sequence has included essential workers. Okay, so the next section is how to help with outreach. So it's important to just take a pause and talk about approaches, the levels of approaches that we can have. We estimate that we have about 28,000 people to vaccinate. And that would be of all of those who are eligible, who are the age 16 and older, and expecting about a 75% acceptance rate. We are anticipating 28,000, but we would love it if it was higher, with a higher acceptance rate. But usually the acceptance rate is hovering around 65 to 75%, though it varies on the group. One way that we are reaching people is through organizations. This is really going to be the most efficient and effective way for us to reach individuals, because we can catch more individuals with less amount of effort. I shouldn't say less amount of effort, but with a manageable amount of effort. So one of our approaches is to go through employers. So we have asked employers to complete the essential workers assessment. Only one point of contact per agency or department would need to fill this out. Basically, it identifies one person who would be our liaison with that group of essential workers. And then it would cover how many frontline individuals they have, and it says what type of sector or occupation work do they do. Just because an employer fills out the essential workers assessment does not mean they will be considered an essential worker once the state defines the criteria. It just gives us a database of all the employers who want to help their staff get vaccinated and have identified someone who would be that point of contact. And then as those essential worker criteria are defined, we'll be able to go from there to vaccinate those who qualify for prioritization. And then when we get to the general public, we'll also be able to go through those employers to vaccinate their staff as members of the general public when we get to that stage, hopefully late spring, early summer. The other approach is to reach out to our community-based organizations and our service providers. They are already serving population groups, and they can also be what we call communication channel out to members of the community and reach a large number of people with 1 to 2, planned efforts of reaching out. So that's one of the groups that this training is targeting, our service providers who can reach out to their clients or to community members that they engage with through their services. We also have the relationship level, which is a smaller network level, would be people that are in your friends and family network, and being able to reach out and help those individuals. And so that's another group that this training is targeting, to be able to have individuals just identify, I have 20 to 30 people in my personal family and friends network. Let me reach out to them, make sure those who have the greatest barriers to the vaccine are able to sign up. And if they have questions, I can answer some of those basic questions and help them access the vaccine. Then the smallest unit of outreach would be to individuals, which would be Lincoln County Public Health reaching out to each individual one at a time, which is a very difficult way, or relying on individuals to reach out to us, which would be very difficult for those who have barriers to accessing us. And so that's one reason why we're really targeting this organizational and relationship level. So how to help within your existing networks through your services that you provide, through your community-based organizations you're a part of, or through your personal relationships, is to leverage your existing networks. So your existing social networks that you have, and extend that network to reaching out to others to help them access the vaccine. We ask that you answer basic questions accurately and honestly. You can use the content in this presentation at the beginning with the COVID-19 vaccine facts to help answer those questions. Help people sign up for the wait list, and when it's their time, help them schedule their appointments, and I'll walk through those 2 tools for you. and help people access their vaccine appointment. If transportation is a barrier, our community-based organizations, service providers, or friends and family can help people find transportation or provide the transportation or help them access some way of getting to their appointment in whatever way that they need. It could be helping them set up an appointment with Frontline or a service like that, or it could be directly driving. Direct people to additional trusted sources for more information. Here's a bullet point with some of this key information, and I have it included in a separate slide with links. Refer specific medical questions someone has to their medical provider. And this is especially important for people who've had severe allergies, who have had COVID-19 and had a specific antibody treatment. They need to wait longer to get the vaccine if they've had an antibody treatment with their COVID-19 infection. And then if they have certain high-risk conditions or personal health histories that make them concerned, all of those questions should always be referred back to their personal medical provider who has their personal health history and knows about the vaccine and can compare the actual risk factors based on that person's individual history. And then, of course, the last one is to respect personal health decisions. It is within someone's rights to deny vaccine and not want to have it and to be left alone about that. So if somebody is interested, that's the group that you want to help get access to the vaccine. And if they're opposed to vaccines, respect that personal choice and move on to helping others who are ready and want the vaccine. So this is just a graphic of vaccine hesitancy. This comes from the National Institutes of Health. Community Engagement Alliance Against COVID-19 Disparities. This shows a continuum of vaccine hesitancy from on the left-hand side in green, where we have those who accept all forms of vaccines and are just ready for every vaccine, to the opposite end on the right-hand side, where it's individuals who will refuse all forms of vaccines and are completely opposed to all vaccines. And then there's this continuum in the middle, a gradient from accepting all, which is accepting but kind of unsure, may have some questions, to refusing, but I'm maybe not totally close-minded about that. And so the goal is to really work with this outreach work in these areas in the green. So those who are ready, totally help them. And then those who are considering accepting but have some lingering questions or concerns, you can answer those questions as long as they fall into the information that we've provided and you're providing the accurate information, or you can refer them to areas of trusted vaccine information, the Centers for Disease Control and Prevention, Oregon Health Authority, Lincoln County Public Health, to answer some of their specific questions that they may have. Strategies for helping people decide whether they want to get the vaccine or not. The big ideas and main goals with helping people is to build their trust in the vaccine and the agencies that have created the vaccine or the agencies that are administering the vaccine, to compare the risk of the vaccine with the risk of COVID-19, not comparing the risk of the vaccine to a healthy life. And then to reduce their perception of barriers and increase their self-efficacy, which is their confidence and their ability to overcome those barriers. So if the question comes down to, I don't know if that'll work with my schedule, I don't know if I'll be able to get transportation, it'll be working through those barriers and identifying a number of strategies that would help them overcome that, or helping them with that, which will improve their self-efficacy, their confidence, and their ability to overcome those challenges. So some ways to do that is to, one, ask how COVID-19 has affected them and their community. So that reminds them that COVID-19 is the thing that we're working to combat against, and is the risk of the vaccine greater or less than that risk of what COVID-19 has or could do to me and my community. Refer to what the experts say about the COVID-19 vaccine safety and side effects. That's building that trust in the vaccine. Be sure to not exaggerate, inflate, or use persuasive or passion words to describe the evidence that undermines trustworthiness in the information you're providing. And the goal is really to provide objective information and let people to sum up what is right for them based on their perspectives and their health history and their readiness right now. In just a moment, let me go back to this. There's a concept called diffusion of innovation, meaning that new innovations or new ideas or new vaccines will diffuse through a population with a predictable pattern. And there's individuals who will be on the late majority, or laggards. So usually they wait a while to see how an innovation works in a population, and then once they're kind of over the bell curve, that's when they've gained their readiness. So for a lot of individuals in this blue area, they may move into the green naturally on their own and then reach out to you or then be ready to talk about vaccines because they've seen it move through the population and they're okay with it now. So that's just something to keep in mind. 4 strategies to help people decide. Tell them why you personally have chosen to get the vaccine. That's when you can use your passion words because you're talking about yourself and your situation and what you care about and your values. And you just make sure you're keeping that about you and your truth. Then you can refer them to their medical provider again if they have any concerns about their health and safety. So this is a slide that shows trusted messengers of COVID-19 vaccine information. This comes from the Reagan-Udall Foundation. That's the specific slide. But on the bottom in my slides, we can also see there's 3 other citations, which actually might be cut off in the viewer that you see. But there's a citation for Mensa, Langer Research Associates. All of those are linked into the end of my slides. And they share consistent information about who's trusted with information about vaccines. So in level of trust, it starts out with someone's personal doctor, nurse, or pharmacist is the most trusted source of health information about vaccines. Next is health experts, then the Federal Drug Administration, but there's quite a bit of gap between health experts and FDA, Federal Drug Administration. Then we have families and friends, their local government, and church and faith groups and employers, and so on down. So that's just important to think about where you fall into this trusted category and who you refer to increase the trust of that messenger or that information that's being provided. Next section, important resources for outreach. So these are links to resources that would be very helpful for helping you do outreach for COVID-19 vaccinations. So this is our COVID-19 main vaccine page, and I will navigate to that using Google just to show you how you can do it without using a link. There is the Lincoln County Call Center, which is open Monday through Friday, 9 a.m. to 4 p.m. This is the phone number, 541-265-0621. And then there's the email address, Lincoln County, Lincoln Co. Call Center at co.lincoln.or.us. There is the Oregon Health Authority vaccine webpage, which shows the prioritization sequence and also has the eligibility checker tool. And then there's the Oregon Health Authority FAQ, frequently asked questions about the COVID-19 vaccine, and this is the direct link to that. Down here too, if you happen to come across somebody who is an employer and thinks they may be employing essential workers, please direct them to the essential workers assessment. And this is mostly for employers, not for individual employees. Individual employees who have employers who have filled out this assessment do not need to be on the wait list. They can be reached through their employers. And so it just helps us not have such a long wait list if we direct them towards their employer and towards the employee essential worker assessment. So demonstration. So I'm going to walk through how to access our Lincoln County Public Health webpage, how to get to our scheduling page and our wait list, and then how to sign up for our wait list and how to sign up for an appointment. And I'm going to pause for a second while I navigate to those web pages. All right, so now I'm on a Google web page, and I'm just going to search for Lincoln County Public Health, and this will take us to our Lincoln County Public Health web page. And then from that page, just for future reference, on the left-hand side, it lands on the public health main page and gives you our different public health programs over here. But the area we're looking for COVID-19 vaccine is this top tab that's located at the very top of this left-hand side panel. And then there's a tab just for COVID-19 vaccine that has a drop-down list. So if you click on this main COVID-19 vaccine webpage, it takes you to our main webpage, which is available in Spanish. If you click this link here, this is any kind of new immediate critical update. This is information about having to reschedule our clinics that were scheduled for this week because of the delivery delays due to the snowstorms across the United States. This is the current list of who is eligible for vaccines as of this week. This is the webpage for the Lincoln County vaccine schedule, and I will click on that in just a moment. This is the direct link to the wait list. And then this is an informational flyer if you would like to post information about Lincoln County's vaccine distribution. You can print this flyer and post it there. So let me take you to the scheduling webpage. So just clicking on that link there, but that's also this link here on the sidebar on the left. So again, the same information about the clinics being rescheduled. The page is available in Spanish, and then these are skip patterns to go down to these main sections in this document. The key places to look for is this is going to be the list of who's eligible in Lincoln County. This is the link to the wait list. And then down below that, here are other clinics that may be available for COVID-19 vaccination. And so this is where you might find other sources of vaccines. So Bimart Pharmacy, Fred Meyer Pharmacy, Safeway Pharmacy. Just keep in mind, please, that the Lincoln County wait list would not be connected to these, and you would need to schedule them separately. And there may be an administrative fee or billing to insurance that's charged with these. We are unknown. We do not know right now what those clinics will look like. So going to our Lincoln County waitlist, this would be how someone gets connected to our mass vaccination clinics that are happening currently in Newport at the County Commons, and then also in Lincoln City at the St. Clair Taft station by appointment only. So this is taking us to the portal where the waitlist is. It may take just a little bit to download because it's got quite a lot of data on it. So you can scroll down to the middle here, right underneath the green bar. Would you like to be on the COVID-19 waitlist? This is the waitlist form here, available in English and Spanish. One question asks if someone needs an interpreter, and that would include needing an interpreter to schedule their appointment when their time comes, and then also needing an interpreter at the COVID-19 vaccine mass clinic. Enter the first name, last name, one person at a time. If there's 5 people to sign up, we would need to do this 5 different times, one for each person. The date of birth of the individual, this is especially important for 2 reasons. One, certain individuals are eligible based on age if they're 65 and older, and because Pfizer, the vaccine for Pfizer is approved for 16 and older, and Moderna is only 18 and older, we need to know if someone is 16 or 18 to be eligible for those clinics, depending on if we're offering Moderna or if we're offering Pfizer. So we need to have date of birth in there. This phone number needs to be whoever can schedule the person's appointment and answer any questions that the person may have about getting to their appointment. This email address is really important, and it would be very beneficial to be able to put in an email address for someone who can schedule the appointment immediately. The fastest way to get the appointment is that when someone's eligible, we send out a scheduling link. They can click on the link and schedule themselves immediately. That is the fastest, most efficient, most effective way to get signed up for an appointment. If they do not have an email, or the email bounces back because we did not get the information input correctly, that means someone from our call center has to call the individual, try to get a hold of them. If they don't answer the phone, then that person will have to call the call center back and then wait in line to get their call answered. So this is not the most effective way or most efficient way, for sure, to get someone signed up. We really need to have an email. We can call individuals, but it is going to take longer to get them scheduled for an appointment, and they may miss an opportunity and may take a couple weeks to get them in. City is important because there are opportunities when people don't show up for their appointment, or when we are able to pull out extra doses. and we have a short amount of time to get someone in to get that vaccine, and we start calling people on the wait list by their priority group. But we call them in from the wait list to bring them in with maybe an hour's notice. And so this is why it would be important to have the city where someone lives or works in, so that when we're calling, and it usually happens between 2 and 7 o'clock, 2 p.m. and 7 p.m. When we're calling to give those doses out. So it'd be important to have both the city in there and then a number for whoever can answer the phone and get that person scheduled and get that person to the appointment. Zip code is important just to make sure people are living in Lincoln County, Oregon. There's a lot of Lincolns around the United States, and sometimes we have people who are not from the state entering in here. This information about which eligibility group they are in is really critical, because we're only going to reach out to those who are currently eligible. So if someone puts themselves as general population, they're not going to hear from us until we get to general population. So it's important to put in phase 1A, which phase 1B group, if they are one of these. If they are a person 16 to 64 with high risk conditions, we have the CDC's definition of the high risk conditions there, but that may change with the state's criteria. And then for essential workers, it can be any of those that the CDC describes as essential workers. We will need to go back through that list when the state defines essential workers and really work through to make sure we can identify what kind of essential worker someone is and whether they qualify and at which group. And then for times that they can attend a clinic, this helps us know if certain groups of people will need a night clinic or need a weekend clinic. Particularly when we get into our essential workers, we expect that to be more of a situation. So please say whether or not they can attend an anytime clinic or if there's specific windows of opportunity. This is about whether someone needs assistance to be able to attend a clinic. That could be transportation to the clinic. We cannot provide transportation for Lincoln County Public Health, but it helps us know what our barriers are, and we can refer people when we call them or we send them an email. We can give them information for how to access transportation as more transportation becomes available. We have wheelchairs and walkers available at the walk-through, roll-through clinics, the mass vaccination clinics. And then if, let's say, someone can get to a clinic, but it needs to be within their city of residence that they marked up higher on the list, that would be an indicator here that they would need, you can check all that apply to this list based on the accommodations that are needed. And the last one is whether or not this person is medically homebound. We know we have a group of people who are medically homebound in Lincoln County, and we're looking to identify them so that we can start working with some mobile vaccine partners to try to plan some routes where we can do the vaccines within that window of viability before the vaccines expire once they're thawed. So it'll be a particular challenge, and it might take us a while to organize that, but if we can start identifying all of who are medically homebound, and the definition for medical homeboundness is here. Then you can click to have a copy sent to you. You can put in a different email address if it's an additional person, and then click submit. It's not submitted until the submission button has been clicked. The next one I want to show is our scheduling link. So when it is someone's time to schedule themselves for the vaccine, they've become eligible and we have vaccine here to give and we have appointments set up, they will receive a link in their email with this same registration page. It'll look different depending on what the clinic is. This is an old one. It's just one for testing and showing examples. It'll provide information about what people need to know about the vaccine, the date, the location of the clinic. This is that form that individuals would need to fill out before they come, or they would have to fill it out when they get there. It is the pre-screening vaccination administration record. Everyone has to do this. Then there's a couple steps to take. One is to click your one appointment that the person would need. Only click one of these. So let's say 9:45 works for me. I need to show up there at 9:45 or maybe slightly before. So I click 9:45 and I only click one. And then down here at the bottom of the page, there's submit and sign up. So I submit and sign up. And it takes me to a second page where I fill out the rest of the groups or the rest of the items. Skip comments and skip quantity. There should only ever be one quantity. because we need to check off a list, the name on a list when they get there, we need to make sure that each person is signed up individually. We cannot sign up 4 people under one name because those other 3 people don't have their name on the list and they won't get in. And it creates a bottleneck when we're checking people in. We have 36 to 42 people coming in at once. So type in name first and last, email address. This will be the email address where a confirmation is sent. It also is the email address that if something is changed, let's say something like this week has happened where we did not get the shipment of vaccines that we were allocated, we had to cancel all of the appointments that we had for this week and move them to next week. So this email address needs to be someone who can reschedule the individual if something happens with that clinic and we need to reschedule. Phone number would be the same thing. If the email bounces back, we're going to be calling to reschedule, and we need it to be someone who can answer the phone and reschedule that. We need to select which dose they're getting. We offer the first dose clinic first, so that would be the first one to sign up for. And then here we have whether or not they qualify for phase 1A by age group. And then eventually when we get the high-risk medical conditions and the essential workers added, those will be additional ones as well. Then the sign up is not submitted until they actually click this sign up now. So put all the information in and don't click sign up. No one is signed up and they show up and their name's not on the list. So need to make sure that all this information gets in, sign up, and then you would go back after you sign up. It's not gonna let me. You would go back to this main page. Let's say if there's 2 of them because it's your 2 parents and they live together, you would go back and try to sign them up for the same time and then sign in. And you can see here it tells you how many appointments are still available at that time. So for 8:45, there's 24 open. For 9:15, there's 38 open. So it'll tell you how many appointments are open at that time slot. All right, go back to my slides and see what else I have to cover. All right, I think I covered all of this. And the last one is the Oregon Health Authority sequence checker, eligibility checker. So Oregon Health Authority vaccine sequence. So this is Oregon Health Authority's main COVID-19 vaccine webpage. Down here under sequencing is the information about Oregon's vaccine sequence. Any new changes to the vaccine sequence will be here. Up at the top, there is this eligibility checker under Get Vaccinated Oregon. It's kind of a runaround because it'll take you back to Lincoln County where we're already providing a lot of this information, but not every county in the state has it. But if you really want to see if you qualify for a group like phase 1A, you can go through this eligibility checker and it asks you these questions of whether you qualify for any of these groups or if you qualify as phase 1B in any of our educator groups or the birth date groups. And then it'll tell you whether or not you currently qualify, and then it will ask you if you want to get notifications of when you do qualify, and you can fill that in. So that's just one other resource. It would still direct you back to Lincoln County Public Health because it doesn't sign anybody up for appointments. It's not a wait list. So we don't recommend using this as in lieu of a wait list. We still would like people to get signed up for our wait list so that we can make sure we can reach them and get them signed up. All right, going back to my slides. I also included in this video just a walkthrough, a screenshot of what that scheduler looks like again. So this is that top of the page. And then here it shows you at the bottom of the page, step 1, select just one of the appointments. And then step 2, submit and sign up. Then on the next page, skip this part up here. Don't write in any comments. Don't change the quantity. And then enter in for each person, first and last name, the email address, the phone, the first dose or second dose, and then which group they're qualifying as. Educators we lump into phase 1A so they can click there. Then submit to sign up. That would be the final step. Somebody's not registered unless this button down here is selected. And then it would give you a confirmation notice. These are all of the references that I have listed throughout the presentation and the links to them so you can read more information about the COVID-19 vaccine. All right, so thank you, Lincoln County, Oregon, for attending this online training webinar. We look forward to having more and more and more of our community vaccinated against COVID-19 because it is our greatest hope for getting back to a normal life and being able to open up our businesses and prevent unnecessary illness and death. So thank you so much.